Good day, Hudson Valley. I'm your host, Lisa Caslin, and welcome to our show where we bring you the best of what's happening and who's happening in Putnam, Westchester, and Dutchess. Today, we're continuing our four-part series with Putnam Family Community Services. We're talking about the behavioral health of our community. And in our third installment, we're addressing the specific issues around children's mental health and well-being. We have a special guest with us today, Julie Doyle, who is an early recognition specialist. She runs a program for Putnam Family and Community Services called RISE, and we'll talk a little bit about that. But the first thing I'd like to talk to Julie about, and welcome. Thank you for coming.
Thank you for having me.
When you talk about the general mental well-being of children, young children, maybe 4 to 12, what does that really mean? What does it mean to have a well-adjusted child?
So when we talk about children being well-adjusted in society, we really talk about children who can form attachment bonds to people and places. To be well-adjusted also means to have self-regulation skills, such as the ability to calm, to soothe oneself, the ability to take perspective of others. That's a lot of compassion and empathy. We also like to see children with cognitive flexibility, ability to solve problems, problem solving, and if they don't have those skills naturally, or if they're a little poor, we like to see children who can reach out to adults in their lives to get those skills.
That makes sense. So what type of issues are you seeing maybe that are most common or prevalent in your practice now?
So at Put Family Community Services, in the children's section, we do see a lot of children coming in for an increase in anxiety issues, social phobias, school avoidance. We also see a lot of kids that have depression. So, you know, a lot of things in society now is contributing to those things. Those are the big two, I'd say, that we're seeing children come in for.
I mean, bullying has been all over the radar for the past few years, actually. And I just wondered, is bullying one of the things that you're hearing may be a significant contributor to these kids?
Sure. So bullying's always been there, and bullying's not going away, sadly. So we do have a program that sends our education prevention team out to the schools, to a lot of the schools in the area, and they work on bullying prevention, and that's a great program that we offer. However, we are still seeing bullying, so that's the sad reality of our world. That contributes greatly to children's anxiety, depression, and self-worth issues. So yes, it's huge, and that's why when we work with the schools in our community, it's really important to do that so that those kids that are feeling the effects of bullying can have easy access to treatment and support. Okay.
Now, if your child is being bullied or may be suffering from anxiety or depression, sometimes I know kids, you know, themselves feel shame. They don't even want to admit that they're being bullied, you know?
Right.
And they may not even feel comfortable telling their parents. So what are some of the signs that a parent may look for that may trigger, something needs to be addressed or talked about?
Right. So this is difficult because some children externalize behaviors, which means they can be aggressive, they can be moody, they can be temperamental, they can act out with their conduct. Some children internalize behaviors. That looks more like isolation, withdrawal from pleasurable activities, withdrawal from their social scene and people they used to have a good time with. The behaviors look differently with different children. So what we want parents and educators and people that have important roles in kids' lives to really be cognizant of is to keep a real strong open line of communication open with these kids, because ultimately talking and looking for nonverbals, so not just the verbal communication, but the nonverbals, it's really crucial, it's really important that people in our kids' lives can identify, hey, what's going on, you know, and then if they have an established well connection, that will be a lot easier for a child who is embarrassed or for just has no idea how to handle this situation. It will just be seamless, it'll be easier to talk to somebody they feel comfortable with.
Okay. So if we talked about screening, so, you know, I'm a parent and I'm noticing some changes in my child, I'm not really sure, you know, is it serious, is it not serious? When do you think it's a good idea to have your child professionally screened?
So it's a good idea at any age. RISE offers a free confidential screening program to children in Putnam County. We can screen children as early as 3 months old all the way up to age 18.
Wow.
We can do that in the home, in the agency, out in the community. So we make it really casual, really easy for families to access that. The screen is really a social-emotional checklist. It's so when parents come to us with behaviors that they're concerned about or they're just confused about, it's nice to be able to say, this is really a typical, 18-month-old behavior,
Yes.
or hey, this is really a very typical 6-year-old behavior. And sometimes if it's not typical, if it's an atypical behavior, it's a persistent behavior and the parents are concerned, then we can say, look, let's go for a further evaluation or assessment, and then we give them and hook them up with the resources in the county that can further that along for them. We try to eliminate as many barriers to treatment as possible because that's important for families.
Do you, I mean, not to put you on the spot, but another item that has been in the news, and the anniversary is coming up next month, Sandy Hook, and there's been many other dozens, if not more, similar incidents in our country, and I'm just wondering if those kids had had screening, at an earlier point in their lives, do you think that that would have maybe changed the outcome?
I like to think it would. The point of the early screening is kind of like an early intervention template. We see results with children with speech, OT, PT issues, and if they have early intervention, they do get better. They get help early. That's the same thing that we're trying to do with social-emotional health. The child can get help early, the family can get help early, and then hopefully those behaviors will cease. I like to think that we could prevent some of these things, and also it's really important, again, for us to work with the schools so that if the schools identify a child that has some atypical behaviors or behaviors they're concerned about, they can reach out to us too. And we can work together with the family and support them in their quest to try to get help for the child.
Well, I would think that it should be a no-brainer for the schools to be working, collaborating with you on that. So let's just say you do have a relationship with the school and a teacher identifies some, changing behavior in the child. They can call you, you can then come in, but do you have to have does the school have to have the parents' permission, or can you
So with our RISE screening, we always have to have parental consent.
Okay.
That's part of it's one of the tenets of the program. That each school is different and each school would do what they do. I don't necessarily know all their rules and directives. However, for RISE, we do need parental consent, and we actively seek that to do the screen. And then we primarily would work with the parent to try to help the child. That would be the goal.
Okay. So do you have any anecdotal or success stories, any feedback from parents that, have said, wow, thanks, this has really made a big difference? Or
Yeah, I mean, it's been a wonderful program. We've been doing it this is the 3rd year. And I have to say, yes, definitely we have a lot of positive feedback from the community. We try to make our presence really known. We attend everything and anything we can to present, to get the word out that we're here, to try to help as many children and families as possible. And we work really well with most child serving agencies in the county. In fact, we have great relationships with a lot of them, if not all of them. And so it's nice because the county's small enough that, like you can just pick up the phone and say, hey, we have a family that's really interested. It makes it nice, and it makes it more personable for the family to know that we know each other, we're working hard for their behalf, on their behalf, and for their benefit.
And you're doing something like 1,000 of these screenings a year just in Putnam, right?
Correct.
That's a huge number.
Yeah.
And you're doing a lot of them in the libraries. So if folks were maybe interested in kind of casually checking you out, they can maybe contact their local libraries, right? And it'll probably be listed on the calendar. And I think at some point, Putnam Family is going to be listing that information on the calendar as well. I wanted to ask you about the parents. So if I'm a parent and I have a child, maybe that is suffering from, something a little bit more severe, how do we help these parents cope? How does Putnam Family help the parents cope?
So in addition to RISE, we have a wide array of programs, and one of the most, fabulous programs we have that supports families is called Family Support and Advocacy. This program is run by professionals who have experienced similar issues to the families that they're serving. So it's real personable. It speaks to their heart, really. And so that's an informal program in the sense that you don't need a formal referral to come in. You can simply make a phone call. Like with RISE, they'll meet you anywhere in the community. They'll meet at McDonald's, they'll meet you at the library, they'll go out to your home, or you can come to us. And what they do is they run a few programs throughout the year, one being Family Connections, which you don't have to register for. It's a drop-in, free child care. It's it's the first and third Thursday of every month. There's also a parenting group, and that's it's time limited, so it's 6 weeks. They do register for that, free child care, and it's really a skill building parenting group. And then, we have family empowerment, we have children's coordinated services, we have lots of programs that speak to the parents' needs and can support them while they are going through this journey with their child.
Yeah, I think that's really valuable because, a lot of times I think, many of these conditions are exacerbated if the parent is stressed out, right?
Oh, completely.
Yeah, so having that support for the parents as well as the kids, I think is really, really critical. And I think you guys are doing a great job with that.
Thank you.
So I think Putnam Family Community Services is very well known in the county for delivering really solid mental health, chemical dependency treatments. And under the third pillar of the organization is sort of where you fall under, and it's the community-based services. Aside from what you just talked about, is there any other services that the community should know about?
Right. So once again, so it's RISE,
Yeah.
and that can go to the the little kids with the focus on the younger kids up to 18. Family Support and Advocacy. We have Family Empowerment Program, which does programming in the home. Children's Coordinated Services. We have in children's case management services, intensive case management services, and we also offer adult case management services. And those are all our community-based programs.
That's great. So I want to make sure that we put up the graphic for more information. So you would be the contact person for RISE. So if anybody's interested in getting an early screening for their child, the number should be up on your screen. And then for Family Peer Support and Advocacy, they should contact Bonnie Soldano, right?
Bonnie Soldano is the program coordinator for that, and her number should be up there as well. And yeah, I mean, anybody really, if you call the agency, ask for one of us. If you can't remember one of us, just ask for Children's Services. We're all pretty knowledgeable as well as who to get the phone call to or not. And it really, it's that casual that you can just call, ask us questions. You can email us if that's more comfortable for people.
And everything is confidential?
Everything's confidential, and we get back to you right away.
That's great. And if anybody wants further information in general about the organization, you can always visit the website at pfcsinc.org. I think we're just about out of time, but thank you. This was wonderful, Julie. I appreciate it. I hope you come back again.
Thank you. I'd like that.
Thanks.
Bye.
Thank you. Good day.